In Unit 12, we will discuss the endocrine system in two separate lectures. Part 1 provides a general overview of the endocrine system, and you will learn about the adrenal glands and the pancreas. Part 2 will focus on the pituitary, pineal, thyroid, parathyroid, thymus, and reproductive system glands. A doctor who treats diseases of the endocrine system is called an endocrinologist. The objectives for the endocrine system are to list, define, and apply word parts to build and analyze medical terms associated with the endocrine system, and to write terms for selected structures related to the endocrine system and match those terms with their descriptions. The endocrine system is composed of 8 primary endocrine glands that assist in regulating the body's activities. The endocrine glands are found in various locations throughout the body, as we will see in a minute. The actions of the endocrine glands also have effects throughout the body. All endocrine glands secrete hormones or chemical messengers directly into the bloodstream, where they are transported to the cells that are awaiting their messages. These hormones help the body respond to stress, regulate blood pressure, and regulate water and salt balance. The 8 primary endocrine glands include the adrenal glands, the pancreas, specifically the islets of Langerhans, the pituitary gland, the pineal gland, the ovaries and testes, the thyroid gland, and the thymus. Some of the endocrine glands also have additional functions in addition to producing hormones. Examples are the pancreas, testes, and ovaries. This slide shows the various locations of the following endocrine glands throughout the body. The thyroid gland is in the neck, the thymus gland is in the middle of the chest, the adrenal glands are right on top of the kidneys, the pancreas is between the 2 kidneys, the ovaries and testes are in the lower part of the abdomen. Hormones are natural chemicals produced and released by the endocrine glands. Hormones are thought of as the body's chemical messengers. The 8 endocrine glands secrete hormones into the bloodstream. In the bloodstream, these chemical messengers go to various organs and tissues to generate a specific reaction by the body. The organs and tissues are affected by their presence. The presence of hormones results in changes such as growth and development of the body. Hormones can act in minutes, hours, or even weeks. Hormones affect metabolic processes, digestion, blood pressure regulation, reproduction, sexual function, and moods. Hormones are powerful. Having too little or too much of a hormone causes various hormone disorders. The level of hormones that is secreted into the bloodstream can be affected by factors such as stress, infections, and changes in the levels of the blood's fluids, causing disturbances such as electrolyte imbalances. When the body does not respond to hormones the way that it is supposed to, hormone diseases can occur. One of the most common endocrine diseases in the United States is diabetes. We will learn more about diabetes when we discuss the endocrine gland known as the pancreas. An adrenal gland is located near the top of each kidney, which is why the adrenal glands are also referred to as the suprarenal glands. Each gland has 2 layers, an outside layer called the adrenal cortex, and the inner layer referred to as the medulla. The adrenal cortex secretes 3 types of hormones that are referred to as corticosteroids. Each one affects the body in different ways. One helps the body to regulate the metabolism and level of glucose. Another assists the body in maintaining an electrolyte balance. And the last type of hormone produced by the adrenal cortex contributes to the development of secondary sex characteristics and is essential for reproduction. The adrenal medulla secretes 2 hormones that are responsible for the physiological changes that enable us to respond and react to stress. One example of an adrenal gland disorder is Addison's disease. Addison's disease occurs if the adrenal glands don't make enough of the hormone that help the body respond to stress, regulate blood pressure, and regulate water and salt balance. How does someone get Addison's disease? Sometimes when people have problems with their immune system, it attacks their own tissues, and damage to the adrenal glands can occur. Symptoms of Addison's disease include weight loss, muscle weakness, fatigue that increases over time, low blood pressure, and patchy or dark skin. Diagnostic tests such as ACTH or cortisol tests are examples of laboratory tests that can help in the diagnosis of Addison's disease. Treatment is to take hormone medication for the remainder of the lifetime. A number of diseases can affect the adrenal glands, including several types of cancer. Fortunately, adrenal gland cancers are uncommon. Most tumors of the adrenal glands are non-cancerous and usually do not result in symptoms that would lead to treatment. Possible treatments that a physician could consider in the treatment of these types of cancers of the adrenal gland include surgery, chemotherapy, and radiation therapy. The pancreas is a long, soft organ that lies behind the stomach and in front of the spine. As one of the endocrine glands, it is responsible for making insulin and producing or secreting enzymes or chemicals that assist the body in the digestion of food. Because this gland releases digestive enzymes that are carried through a duct to the duodenum, it is also referred to as an exocrine gland, which is defined as a gland that produces and sends its chemicals using a tube or duct. The endocrine function takes place in the pancreatic islets that secrete glucagon and insulin. More specifically, the alpha cells secrete the hormone glucagon in response to a low level of glucose in the blood. Insulin, the hormone produced by the beta cells in the pancreatic islets, is produced in response to a high level of glucose in the blood. Diabetes mellitus, commonly referred to as diabetes, is a disorder that is identified when the blood glucose or blood sugar level remains above normal levels. With type 1 diabetes, the pancreas does not make insulin. Insulin is a hormone that helps glucose be absorbed into the cells that allow them to create energy. Without insulin, too much glucose stays in the blood. With this excess, damage can occur to the heart, eyes, kidneys, nerves, and even the gums and teeth. Symptoms of type 1 diabetes include thirst, frequent urination, feeling very hungry or tired, unexplained weight loss, sores that heal slowly, dry itchy skin, tingling or loss of feeling in the feet, and blurry vision. A blood test can determine if the patient has diabetes. If diagnosed with type 1 diabetes, the patient will probably have to take insulin for the rest of their life. Type 2 is the more common type of diabetes. With type 2 diabetes, the body does not make enough insulin, or the insulin it makes is not used well. While some people have no symptoms, others have fatigue, thirst, weight loss, blurred vision, and frequent urination. A blood test can be used to diagnose type 2 as well. The treatment may include exercise, weight control, adhering to a diabetic diet, as well as monitoring the glucose level and taking oral medications. Some patients with type 2 diabetes also have to take insulin. As you recall, the pancreas is considered an accessory GI organ. Pancreatitis, or inflammation of the pancreas, is a disease that occurs when digestive enzymes start digesting the pancreas and nearby tissues. It can be categorized as either acute or chronic. Symptoms for acute pancreatitis include swollen and tender abdomen, nausea and vomiting, fever, a rapid pulse. Symptoms for chronic pancreatitis include some of the same symptoms, but have additional ones also: nausea, vomiting, weight loss, diarrhea, and oily stools. A variety of procedures can be used to diagnose both chronic and acute pancreatitis. Examples include abdominal ultrasound, CT scan, endoscopic ultrasound, and MRI. Treatments for acute pancreatitis include intravenous fluid, antibiotics, pain medication, and therapeutic endoscopic retrograde cholangiopancreatography, or ERCP. Treatment for chronic pancreatitis may require the patient to be hospitalized for some of the same treatments, such as IV fluid or pain management. In addition, these patients may require nutritional support with nasogastric feedings. Cystic fibrosis, or CF, is a genetic disorder in which thick, sticky mucus can block the tubes in the pancreas as well as other locations in the body. CF is an inherited disease of the mucus and sweat glands. It affects mostly the lungs, pancreas, liver, intestines, sinuses, and sex organs. CF causes the mucus to be thick and sticky. The mucus clogs the lungs, causing breathing problems and making it easy for bacteria to grow. This can lead to problems such as repeated lung infections and lung damage. The symptoms and severity of CF vary widely. Some people have serious problems from birth, and others have milder version of the disease that does not show up until they are teens or young adults. Diagnostic tests include CF gene mutation test, CF respiratory screening, sputum tests, sweat tests, trypsin and chymotrypsin tests, and trypsinogen tests. Although there is no cure for CF, treatments have improved greatly in recent years. Until the 1980s, most deaths from CF occurred in children and teenagers. Today, with improved treatments, people with CF live, on average, to be more than 35 years old. Both the endocrine and exocrine cells in the pancreas can form tumors. However, tumors commonly occur in the exocrine cells of the pancreas. These are referred to as adenocarcinomas, which indicates that the cancer has started in the gland. While some tumors are benign, non-cancerous, the majority are malignant, cancerous. Cancer of the pancreas is the fourth leading cause of death in the U.S. Some risk factors for developing pancreatic cancer include smoking, long-term diabetes, chronic pancreatitis, and certain hereditary disorders. Pancreatic cancer is hard to catch early. It doesn't cause symptoms right away. When the symptoms do appear, they are often vague or not noticeable. Symptoms include yellowing of the skin and eyes, pain in the abdomen and back, weight loss, and fatigue. Also, because the pancreas is hidden behind other organs, healthcare providers cannot see or feel the tumors during routine exams. Because it is often found late, it spreads quickly. Pancreatic cancer can be hard to treat. Each type of tumor has different symptoms, and each is diagnosed using a different diagnostic test. Treatment options and survival rates vary depending on the type of tumor identified. Possible treatments include surgery, radiation, and chemotherapy. Treatment is determined by the stage of the cancer. Staging refers to how far the cancer has progressed. In summary, we have covered the adrenal glands and pancreas and provided a general overview of the endocrine system.